To start with, you've got to have a proper diagnostic formulation, which looks at physical, psychological and social factors and looks at the development of the child from predisposing factors in the uterus and early childhood to precipitating factors which may have sparked off an emotional disturbance, to those factors which keep the emotional disturbance going, the perpetuating factors, and also looks at what strengths the child has. Now, without that, you can't really develop a proper treatment program. So what do you do then? What you do then is you take those things which are alterable in a reasonable time, and with the facilities you've got available and the strengths you have available, and you say, let's say there are 6 problems you pick out as critical, pivotal problems. If they were to change, the whole picture would change greatly. You take the problem, rewrite it as a goal. So the problem may be that the person's got a depressive mood. So a simple goal would be alleviate depressive mood. But the next issue is, well, how do you know if you've alleviated? What is it that you will see, taste, smell, feel, hear about that will tell you that this particular goal is reached? In other words, there'll be objectives you look for. For example, what the child is like every day that a clinician interviews them, let's say they're in hospital, or the nursing staff interview them. So in other words, you have a monitoring program that lets you know if you're moving in the right direction, or if you're static, or if you're going backwards. Because then if that's happening, the team or the individual therapist have to say, this isn't working, what are we going to do? Is the goal unrealistic? Is the treatment that we're using for that goal being properly applied, or is it inappropriate for this particular family, and so forth? So knowing how you're doing, having a monitoring program based on the objectives which come out of the goals is the critical thing. Otherwise you get therapeutic drift. People stay in treatment and they don't seem to change that much, and 6 months later somebody says, I think he's a bit better, don't you? They say, oh, I don't know, maybe he is. This should be something that you're looking at every time you see the child. And if it's not working, what are you going to do about it, is the question. So a goal-directed treatment program is a check on the progress of treatment, but it's also a way of rationalising which treatment or treatments you're going to use in a particular case.